This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly health news in review coming to you from the Health Broadcasting Service HBS Radio channel. In today's weekly review, we will be looking at two major events which have dominated the global health scene. First, bird flu spreads on U.S. poultry farms. The U.S. Department of Agriculture reported outbreaks of a highly lethal type of bird flu in commercial flocks in Maryland and South Dakota over the weekend, adding to concerns that wild birds are spreading the disease across the country. Farmers are ordered to kill their flocks after the disease is detected, and importing countries including Mexico, China and Korea have imposed state-specific import restrictions in response. The bird flu outbreak is the worst since 2015, when nearly 50 million birds, mostly turkeys and egg-laying chickens in the U.S. Midwest, were killed. It comes at a time when food prices are skyrocketing due to labor shortages, supply chain problems and the Russian invasion of Ukraine, a key wheat and corn exporter. The disease is already widespread in Europe and affecting Africa, Asia and Canada. The United States is the world's largest producer and second largest exporter of poultry meat, according to the U.S. government. USDA reported the H5N1 strain in wild birds in the Carolinas earlier this year. The strain can be passed on to humans, though U.S. officials said there is a low risk to people. Below are other outbreaks reported by USDA to date. In Missouri, USDA reported an outbreak of a highly lethal type of bird flu in a commercial flock of chickens being raised for meat in Stoddard County, Missouri, on March 4. The outbreak was confirmed as the H5N1 strain of avian flu in a flock of about 240,000 broiler chickens in the southeastern Missouri County, the USDA's Animal and Plant Health Inspection Service said. Iowa reported a highly lethal form of bird flu in a backyard poultry flock of 42 chickens on March 2, expanding a U.S. outbreak of the disease to the top egg-producing state. In 2015, Iowa was at the center of the biggest ever U.S. outbreak of avian flu. And in Delaware, a commercial poultry farm with 1.2 million birds was hit by highly lethal bird flu on February 23, significantly expanding the number of birds impacted in the United States. And in Kentucky, a flock of about 240,000 chickens owned by Tyson Foods Inc. in Kentucky tested positive for a highly lethal form of bird flu, government officials and the company said on February 14. Testing confirmed a highly lethal form of bird flu in a 53,286 bird commercial turkey flock in Kentucky, the state said on February 16, expanding outbreaks in the U.S. poultry sector. In Indiana, USDA reported an outbreak of highly pathogenic avian flu in an Indiana turkey flock on February 9. The outbreak infected a flock of 29,015 birds, the nation's first case in a commercial poultry operation since 2020. Indiana also reported a case of H5 bird flu at a commercial turkey farm on February 15, impacting a flock of 26,625 turkeys. In the second story, Hong Kong reports 25,150 new daily coronavirus infections. Hong Kong reported 25,150 new coronavirus infections and 280 deaths on Monday, as authorities struggle to contain a worsening COVID-19 outbreak which has torn through hundreds of nursing homes and hit many of the city's unvaccinated elderly. While Hong Kong was successful in controlling the virus in 2021, it has recently seen COVID-19 infections soar to a total of around 500,000. Most of the Chinese-ruled cities' more than 2,200 deaths have been in the past 2 weeks. Health authorities said 161 of the deaths reported on Monday were in the past 24 hours, while 119 were older fatalities processed with a delay. Hong Kong reported the most deaths globally per million people in the week to March 6, according to data publication Our World in Data. The figures come as the global financial hub clings to a dynamic zero coronavirus strategy, which is in mainland China seeks to eradicate all outbreaks. Many other countries are meanwhile shifting to a strategy of coexistence with the virus. The deluge of cases has swamped Hong Kong hospitals, isolation centers and funeral parlors beyond capacity and left the healthcare system, public transport, malls, postal services, supermarkets and pharmacies struggling without staff. Anxious residents have emptied supermarkets ahead of expected compulsory mass COVID-19 tests, with many shelves left bare for over a week. Many businesses including restaurants and stores have shuttered, with main districts notably quiet and few residents outside on the streets. The city has implemented its most stringent restrictions since the pandemic started in 2020, with a ban on public gatherings of more than 2 people and most venues closed. Flights into the city are banned from most countries, including the United States and Britain. FDA approves expanded use of Bristol Myers cancer drug Opdivo. Bristol Myers Squibb said on Friday the U.S. Food and Drug Administration had approved the expanded use of its cancer drug Opdivo along with chemotherapy as treatment that patients with an aggressive form of lung cancer receive before surgery. The approval was based on data from a late-stage study showing the drug along with chemotherapy improved event-free survival and pathologic complete response compared to chemotherapy alone in patients with resectable non-small cell lung cancer, the drug maker said. Non-small cell lung cancer is the most common form of lung cancer, accounting for about 85% of the estimated 2.2 million new cases of lung cancer diagnosed each year worldwide, according to the World Health Organization. Opdivo, Bristol's flagship cancer drug that was first approved in 2014, brought in $1.99 billion in sales during company's last reported quarter. The drug is used in patients with several types of cancer including bladder, lung, blood, head and neck and advanced melanoma. It belongs to a class of drugs designed to help the body's immune system fight cancer by blocking a protein called programmed cell death protein 1, PD-1. Before we begin to round up this week's review segment, we will look at the general global COVID-19 infections rate and death situation. We will look at 3 randomly selected countries, starting with the United States. United States leads the world in the daily average number of new deaths reported, accounting for 1 in every 5 deaths reported worldwide each day. The US is 5% of peak and falling at 94 infections per 100,000 people reported in the last 7 days as at the time of this report. The average number of new infections reported each day in the United States falls by more than 124,000 over the last 3 weeks, 16% of its previous peak. COVID-19 infections are decreasing in the United States, with 44,226 new infections reported on average each day. That is 5% of the peak, the highest daily average reported on January 15. There have been 79,377,922 infections and 963,208 coronavirus-related deaths reported in the country since the pandemic began. The U.S. vaccination history. United States has administered at least 555,332,256 doses of COVID vaccine so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 84.6% of the country's population. Next, let us look at Australia. Australia passes 3 million reported COVID-19 infections. Australia is reporting 24,608 new infections on average each day, 33% of the peak, the highest daily average reported on February 2. There have been 3,039,280 infections and 5,464 coronavirus-related deaths reported in the country since the pandemic began. Australia is 33% of peak at 679 infections per 100,000 people reported in the last 7 days, as at the time of this report. Australian vaccination history. Australia has administered at least 54,492,395 doses of COVID vaccine so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 107.4% of the country's population. Finally, let us look at Austria. The average number of new infections reported in Austria has been increasing for 7 days straight. Austria is reporting 31,474 new infections on average each day, 93% of the peak, the highest daily average reported on February 2. There have been 2,924,852 infections and 15,071 coronavirus-related deaths reported in the country since the pandemic began. Austria is 93% of peak, at 2,481 infections per 100,000 people reported in the last 7 days as at the time of this report. Austria's vaccination history. Austria has administered at least 18,060,574 doses of COVID vaccine so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 101.7% of the country's population. Feel free to connect with us on our Facebook platform, at Health Broadcast, and our website at www.healthbroadcastingservice.com. And please remember to press the subscribe button to stay abreast of timely, vital and authentic health news developments from around the world, delivered to you by the Health Broadcasting Service on YouTube channel. We will bring you more updates as news develop. Stay safe, remain healthy. And bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.